Dermarollers can be a tempting at-home beauty tool, but there are definitely risks to consider, especially if you're not a trained medical professional. Here are some of the potential problems you could encounter. Attempting to use a dermaroller for hair loss without proper medical training carries several significant risks. 1. Skin damage. Improper use can lead to bleeding, bruising, redness, tightness, itching, and peeling of the scalp. 2. Infection. The small wounds created by microneedling can become infected if the device is not properly sterilized or if aftercare instructions are not followed. 3. Scarring. Incorrect technique or overuse may cause permanent scarring of the scalp. 4. Ineffective treatment. Without proper knowledge of needle size, pressure, and technique, the treatment may be ineffective or even counterproductive. 5. Difficulty targeting areas. It's challenging to properly treat certain areas of the scalp, like the back of the head, without professional assistance. 6. Overuse. Non-professionals may not know when to stop, potentially causing more harm than good. 7. Improper adjunct treatments. Professional microneedling is often combined with other treatments like platelet-rich plasma, which are not available for at-home use. 8. Increased side effects. Using treatments like minoxidil immediately after microneedling can cause increased burning, itching, and irritation due to enhanced absorption. 9. Complications for certain conditions. Those with a history of acne, eczema, diabetes, or who are on blood thinners may face additional risks without proper medical oversight. 10. Pain. Professional treatments typically involve numbing medication, which is not available for at-home use, potentially making the procedure very painful. Given these risks, dermatologists strongly discourage at-home microneedling for hair loss. Always consult a professional and understand the risks of going it alone.